Hi. In our last video, we discussed various methods of weight loss, mainly bariatric surgery, GLP-1 injections like Mounjaro and Ozempic, and ballooning. Today we will discuss about the ballooning procedure. So what is ballooning? Ballooning is a medical device shaped like a balloon, which takes up physical space in our stomach. By doing that, it reduces the capacity of the stomach, so it restricts the amount of food that we can consume. And secondly, what it does it stretches the stomach, which activates the stretch receptors, and a signal goes to our brain that our stomach is full. So this decreases our hunger and cravings. Now, how is it different from the other two procedures? Unlike injectable, it's not causing any hormonal or any chemical changes in our body. It's a physical thing. It's not interfering with the chemical processes. And unlike surgery, it does not require any anesthesia. There is no surgical procedures. There is no permanent changes being made to our body. This is a temporary thing. Balloon does not permanently stays in our body. So fast and convenient to do. Whole procedure takes hardly 15 minutes. So the convenience is one of the reasons for its popularity. Now coming to the procedure itself. So the balloon is wrapped up in the shape of a capsule. There is a small thin catheter attached to it, and there is a fluid, around 500 ml of fluid, which is used to fill up the balloon. So on the day of the ballooning, patient swallows the capsule along with water, like we usually take our normal tablets. And once we check that it's reached up to the stomach, the position is confirmed on an X-ray. So once we are sure that balloon is right in its right position, then we attach it to the fluid which is provided, and we start filling up the balloon. So around 550 ml of fluid is filled, and once the fluid has been filled, we again confirm the position of the balloon on the X-ray, and once we check that it's in the right position, we pull out the catheter. So there is no anesthesia required. It's fairly quick process, 10 to 15 minutes, and if possible, patient can also go to the home same day. Now post procedure, some patients they may experience abdominal cramping and some acidity, which is usually temporary in nature, usually settles in 24 to 48 hours, and these symptoms are controlled with medications. Diet also, after the procedure, we start with liquids, gradually increasing it to semi-solids, then normal foods. Some changes which are intended to happen after ballooning is the amount of food consumed is smaller in quantity, because there is space restriction in our stomach, so we consume small amount of foods. And because again stretch receptors are activated, we also feel less hungry also. What happens by this is body start using its own fat stores, and this is the mechanism by which weight is lost. So after 4 to 6 months, the balloon comes out automatically. It comes by itself. It's pass out in the motions. And the theory behind this procedure is that if for a period of 4 to 6 months we are surviving with small quantities of food, our body gets trained, our brain gets trained that we can survive with smaller amount of foods also. And if that habits persist, the weight loss is maintained, or even more weight loss can also be achieved even after the procedure. This procedure is suitable for those people who are looking for, say, in the range of 15 to 25% of body weight loss, and who are scared of surgery, scared of anesthesia, or they do not want to take injections, or they are scared about hormonal changes that injections may cause. For them, this is a procedure that can be done. Needless to say, it's always mandatory that you consult your doctor, discuss with them before you opt for any procedure. Thank you.